As we change focus and start talking about teaching and learning, we need to think about health promotion and lifestyle choices. When you are getting ready to refer to this material, this is going to be covered in your Nursing Concepts book, Concept 40 of the Giddens book. So with the increased technology, we are seeing increased advances in healthcare. The shift of attention toward treatment of illness to the promotion of health is going to be our driving force. So what we're wanting to do is focus on primary prevention. So establishing a health promotion plan is going to be very important. This plan needs to be very individualized, so you need to complete an individual assessment. In that assessment, you need to consider your patient's age, their current health status, presence of risk factors, health preferences and values, and as well as social relationships. When you are considering the person, you also need to consider the family assessment. So think about the family that they are around, or if they have family, what that family involvement is going to be. So among that family assessment, think about specific risk factors, family strengths, what types of relationships are occurring within that family unit. Also, genetics will play a huge part when you're planning a health promotion plan for an individual. As you look broader and think about the community, because you need to think health promotion on a community and population level. So when you think about a community assessment, you need to think about the structure of the community consensus, as well as how many people are in that community. So considering population, the demographics, what are the morbidity and mortality statistics surrounding that community. And with populations, the health promotion interventions, really when you are thinking about health promotion at any level, you need to think about education. We want to focus on immunization and those primary preventative means, screening assessments, nutritional health, physical activity, pharmacologic agents, especially when you're thinking about some of the hot topics in healthcare, so smoking cessation and weight loss. So what types of management are we going to be able to utilize for those types of things? So what I want you to do now is pause your computer, and I'd like you to take a few moments and match these related terms to the definitions. So after you've taken a moment to do those, a positive state of health that is continually changing is wellness. Physical manifestations and subjective experiences is illness. Functional or structural disturbance, disease. And a state of complete physical, mental, and social well-being, it is not merely an absence of disease, is considered health. So as we take a look at the concept of health, wellness, and well-being, health promotion is the process of enabling people to increase control over and to improve their health. And health promotion has been shown to add quality of years to life and to decrease healthcare costs. So that's why we're seeing such a huge focus on primary prevention and the prevention of diseases versus taking care of people that come into healthcare because they have illnesses and they have different disease processes. So nurses are really central to meeting national healthcare goals. When you think about health, it's a state of complete physical, mental, and social well-being. So it's not just saying that you are not ill or you do not have a disease, but it involves the entire person. So it's taking a look not only at their physical abilities, but also thinking about how they are mentally as well as socially. When you're thinking about wellness and well-being, those are really focused around a positive state of health. So it's looking at positive things as far as the individual, family, community. It's going to encompass that physical and mental components just like health, but you also need to add in spiritual aspects, and spiritual doesn't always just mean the church or God. Spirituality has a specific meaning to each and every person. Thinking about their social views, what is their occupation, what type of environment are they living in, also putting into effect the intellectual and financial abilities that these people have. So when you think about health, wellness, and well-being, those are going to be continually changing for the person that you are working with. So our goal as healthcare providers is to empower people to increase control over and improve their health. So when we take a minute and step back from health and wellness, you need to consider things that are going to cause variables to health. What are things that we as nurses know are going to be variables to good health, to having a well-balanced sense of well-being? So when you think about that, you need to really consider the family influence. And family is not just mom, dad, children. Family is what each person considers it to be. Because also part of this unit is cultural diversity. And so you need to think about how different cultures view families and family roles and relationships. So there's several different definitions that you need to be aware of. So when you think about consanguineous, that is actually blood relationship. Affinal, AFFINAL, is marital relationships. Family of origin is the family unit that you are born into. And household accommodates other varieties of family styles. So there's lots of different definitions that you can put on or tag to the definition of family. When you think about parental roles, the motivation for being a parent and for parenthood, the preparation for parenthood, the transitioning into parenthood, all of those things are going to play a role in how that parent develops and expands their parental roles. Factors that are going to affect the transition to parenthood are going to be parents with previous experience. So obviously, if you don't have any children, you're not really sure of what that parental role is going to be. So parents with previous experience, it's going to be dependent on the amount of stress that that parent is under. Any special characteristics of the infant. So do you have an infant with special needs? Do you have a healthy newborn infant? Do you have an infant that maybe has some congenital anomalies? We also need to think about both parents, so mother and father. So is there father involvement? And then also considering those marital relationships. When you think about parenting behaviors, parents choose a style of control to parent with. So you can think about someone being authoritarian or a dictator. You may have parents that are more permissive or the laissez-faire, authoritative or democratic. So there's different types of parenting behaviors that will play a part in the roles of parenthood. Also, we need to think about how is that parent able to learn? Are they going to be able to learn how to become a parent? Do they have that mental capacity? What is the size of the family? Who all is part of that family? So are you talking about the status quo, mom and dad, male, female, or is it a gay or transgender, bisexual? Is it a lesbian household that they are being born into, as well as sibling interaction? So are there different other siblings in the house? Do we have a blended family? So there's been some type of divorce, and then you have step siblings and things like that. So there's lots of different things to think about. We also need to think about limit setting and discipline, minimizing misbehaviors, but then you have to think about parents and the degree of what their discipline is. So is it reasoning and scolding, ignoring, behavior modifications, timeouts, corporal punishment? So lots of different things are going to be associated with limit setting and discipline. We need to accommodate for contemporary parenting situations and understand that they are going to be affected by what type of family composition that you are dealing with. When you look at the psychological and cognitive effects, those are going to really be dependent on the state of that the parent is in, and how they will or portray themselves to their children. When you think about illness and disease, the effects of illness on the client and family, they're going to have definite effects, because you need to think about those family roles that we kind of recently just touched on, and how that will in turn affect the entire household. So when you think about disease is functional or structural disturbance that causes a person's adaptive mechanisms to counteract stimuli and the stresses fail. So when you think about diseases, we need to think about how those will affect the person. So it can be functional or structural. Think about CHF, think about an amputation. When you think of illness are those physical manifestations, and they're really subjective experience to illness. So it is possible then that illness can be present in the absence of disease. And it's possible to have no illness when a disease is present. So think about that, and think about what you know about diabetes and the effects of diabetes on people. So with health promotion, we need to think about the three different types. So your primary, secondary, and tertiary. And we also need to think about what is our role, and how are we as nurses going to be part of this huge health promotion push that we are seeing in the United States right now. So the nurse's role is, we're going to work with individuals, we're going to work with communities, organizations, populations. We're going to work with people to enhance health. So enhance health, enhance well-being, enhance wellness. So with primary prevention, the focus of primary prevention is optimizing health. It's preventing diseases. So what can we do to prevent diseases? Immunizations, safe living conditions, safe working conditions, hygiene, sanitation. Those are the things that we can think about on one end of it. But we also need to think about optimal nutrition. Diet and exercise is important. Avoiding harmful substances, protecting yourself from injuries, car seat safety, putting your seatbelt on. Those are all good examples of primary prevention. With secondary prevention, that's going to be more focused on screenings. It's to identify individuals who are at risk. It's early treatment to limit disabilities. So it's those screenings, it's the colonoscopies, the mammograms, chest x-rays, EKGs for people that are at high risk. When you think about screening, the importance behind screening is that you always need to remember that it must be valid and reliable. So to be valid, you have to, it has to accurately detect the illness, and then to be reliable, it has to prove the same results even when different people perform it. So a different person performs a blood glucose on the same patient, we should see the same results. That's a reliable tool, a bedside glucometer. So secondary prevention then is going to fall into those screenings. When you think about tertiary prevention, that's going to be restorative. So that's someone that's had a stroke, and we involve them with speech therapy, occupational therapy, physical therapy. We're optimizing the management of a condition. We want to minimize complications. So taking that diabetic patient and getting them to a euglycemic index. Medication adherence and compliance. Physical activity. So when you think about tertiary prevention, think about setting goals and meeting goals. And there will be a result to that goal. So it's either met or unmet. And if it's unmet, what can we do to get them to a better place so they don't have adverse outcomes? I'm going to stop here, and I will continue on the next presentation with health promotion.